I really want this to be, okay. I really want this to be very practical for you, those of you who want to use some of the techniques, and it really is that you can lift different ones out of this whole protocol and use them for other things. So I'll try to do it in a way that you can see where you could do that. So when I get a person to do medical work with, the very first thing I do is tell them that I'm going to need a medical referral. The doctor, we have a lot of doctors in Sarasota because there's a lot of elderly people here, and many of them want to have a new knee or a new hip or a new shoulder or whatever. So really kind of came into this line of hypnosis very much with an eye to where's the demand going to be, you know. And so I'm going to get rid of this thing here. And okay, so that's kind of step one, is to get a medical referral. And I have a form that I can send them and get them to take it to their doctor and get it. If I've only think I've had one psychiatrist who was not willing to sign the form. And as a result of that, his patient immediately stopped seeing him. He said, if you're not open to that, then I think you're being way too closed off. So so most of them are very, very helpful. As soon as I get that form, I write to the doctor and tell them that I appreciate the referral, that I will be sending them a letter, a follow-up as we work together to let them know what's happening, you know, what I observe, and maybe would help them. In the back of my mind is I want to help make that doctor rich and famous, you know, so that they don't feel like we're cutting into their field of work and, you know, and competing with them in some way. So for the pre-surgical work, I do a PowerPoint slide set. I guess I may be the only hypnotist I know of that works with a lot of PowerPoints with their clients. And actually, Odette and Patsy and I are going through those slide by slide by slide, so they can get a sense of what's on them, where they came from, why do I put that in my first meeting with a client. And it explains a whole lot about hypnosis, because I really want to begin the hypnotic process immediately when I talk to the person on the phone. I heard a recommendation one time, I don't remember who it was from. They said, don't do hypnosis, be hypnotic. And I thought, ooh, I like the sound of that. I think I'm going to try to work that into my way of being in the world, is to be hypnotic, because what that really means to me is help people get maximum performance out of their mind-body system. And you can't do it with only your conscious mind at work. You know, you really have to engage that unconscious. So I cover some things in the, and I'm just going to really quickly go through a list of things that I use. And if you don't understand what they are, I'd be happy to work with you on the telephone or whatever, just to explain, because they're all very powerful techniques. One is goal setting. One of the first things we do is goal setting, and I use the concept of dominant thought. And Odette, I really discovered that we had two books with almost the same title. And the one you sent me is really a description of dominant thought, only they never called it that. So when we go through that in the PowerPoint, you'll really get a sense of how to answer the questions that you had about it. And okay. So I tell them about change is kind of like climbing a ladder. I said, you came to see me, I assume, because you want to change something. You want to change your mind. I found that clients come to see me because they believe that something is true and it's really not, or they believe that something is not true and it really is. And I can't just come right out and tell them that that's what I think is going on, or they probably hit me with a 2x4. So I have to develop some sort of a discovery process and see if they would come to that conclusion or not. I also a kind of binary description of my client is they want to do something, they've decided they want to do it, their conscious mind's made a decision, and they're not doing it. Like, I want to go to the gym 3 days a week. Well, and they start, and the first week, second week, they do pretty good. And then the second week, it's 2 times, or the third week, and then it's 1 time, and then it's a long time. And, so they don't understand, well, why I made the decision. Why am I not doing it? I had good reasons for it. I understand. And so there's that aspect. And then the other group is they want to stop doing something and they're not able to. And they've decided they want to stop. I want to stop biting my fingernails or whatever it might be. And they just keep doing it. And that's a mystery to them, that once I made the decision, why isn't it happening? So then we get into the discussion about conscious and unconscious minds. But I use a lot of metaphors where I can, and hopefully have a picture of it. And I tell them, do you want to make a change? It's kind of like climbing a ladder. You walk up the ladder, you put a foot on the rung, and you reach up and grab the next rung, and then you pull yourself up. And all. I said, if you are unwilling to let go of anything, that's as far as you're going to go. So my question to you is, what is it that you're going to have to let go of in order to do what you want to do? And I guess a good example of that would be to keep people from getting blindsided. Golfer comes in, says, I want to take 8 strokes off of my handicap. And I say, okay, great. Well, who do you play golf with? Oh, me and 3 other guys. We've been playing golf for 20 years with each other. And I said, you have a lot of fun? Oh, yeah. Who usually wins? Well, we never know. It could be one, then another, it just kind of rotates around. And I said, well, I need to ask you a question. How do you think they're going to feel when you win every time? And how are you going to feel when you win every time? They're not competition anymore. He said, oh, I never thought about that. I don't think they're going to be happy with that at all. And I said, well, it's just my way of making sure you don't get blindsided. You make it look like this little change is going to be isolated all by itself, and it's not going to have any ripple effects and all, but your changes do have ripple effects through families, friends, the whole, through the world. He said, yeah, you're right. Thank you very much. I'll see you around. And he got up and walked out. I thought that was a success to me, because he got more of what he wanted than what he thought he wanted, I guess. So I really like to let clients know that change is gonna mean more than they may have thought it was going to mean to begin with. I tell them that I want them to have a lot of confidence about being successful with what they're doing. And I have a stair-step slide that I show them, and I say, the level of confidence that you have is usually inversely related to the level of doubt that you have. So if you just hope that we're going to be successful, or you wish that we would, or you think we might, or you believe that we can, or that we can, whatever, those are words that we use just to describe different levels of doubt. So where's your doubt coming from if they're down lower on the thing? And we have a good discussion about that, and we talk about how doubt is a success destroyer. So get them to be aware of that. We go through definitions of hypnosis and trance. And I sent Odette and Patsy a list of my pet peeves, I guess. And one of them is people who use those words interchangeably. And to me, hypnosis is the process and trance is a state. And so I try to get them to see that we're going to use a process called hypnosis, but the state that we're going to be in is called trance, and it's a very comfortable, familiar state that you're in at least twice a day when you go to sleep and when you wake up the next morning. You pass right through the alpha and theta states that seem to be where hypnosis lives and does its best work. So just get them used to the idea of using some of the language in a particular way. Um, I have a slide that I got from a lot of clients saying, how do you know that you are hypnotized or that you were hypnotized, either one? And there are 10 or 12, 14 different things on it. And I said, I don't know if you're going to experience any of these or multiples, or maybe none of these, or maybe something that's not even on the list, but I want you to know about it, because a lot of people move out of their beta awake state and they're in this great big overstuffed chair that I have in my office, and they're really going into a really nice slipping out of a beta wave and into alpha and theta. And all of a sudden they'll go like this, you know. I said, what happened? He said, well, I felt like I was falling. And I said, I promise you're not going to fall out of that chair. It's impossible. And if you do look like you're getting ready to, I'll run over and put you back in the chair. So it's just the idea that I want to ratify almost anything they experience is, oh yeah, that was hypnosis. The process that we were using put you into a trance, and you weren't comfortable with it or familiar with it, and so it scared you a little bit, and you popped all the way out of this nice trance you were in and went all the way back to being wide awake. So that's just to prep them for what may happen. And it's got things on it like you may feel cool, or you may feel warm, you may feel heavy, you may feel light, you may see colors, you may have an experience of being asleep. You may feel like nothing happened, you know. So there, about every option you can imagine is on the slide. But so I want to use every possible way to make them successful, no matter what they do. You know, they're going to be a hit at what they're doing. Talk about having a special place, a geographical location that they can go to. And one of the favorites that people seem to come up with is this scene behind me here is a nice, the Blue Ridge Mountains, you know, just a very nice, quiet, peaceful place. But I tell them that if you don't have one, we're going to create one and in the process. And if you do have one, I'm going to ask you to make some modifications, some brief modifications to it that will make it even more attractive. I said, most of my clients say that they use this when they go to see the dentist. They just get in the chair and say, okay, I'm going to my special place and you go ahead and do whatever you're going to do, but I'm not going to be in my body while you do it. And it really does help them to relieve some of the anxiety, to lessen the pain that they might experience from having a Novocaine, or I guess it's lidocaine needle stuck in their gum and stuff. So we use the special place idea. I teach them a little bit of NLP to set up an anchor in themselves where they can call on their inner resources on demand. And I usually have them use this area right between their thumb and pointer finger, squeeze that whenever they're having a wonderful feeling of joy, happiness, success, and you know, whatever. And they put that anchor spot right there, and it's good because they can do it under a table. They don't have to let anybody know what's happening. And I say, you really need to access your inner resources on command, and this is a good way to do it. So they learn about that part. I ask them about their relationship with the universe, and this gives me a whole lot of information. I say, you know, the way I look at it, there's three possibilities. You either feel like the universe is out to get you, and you're fighting all the time, all by yourself usually, to be successful or to avoid, having a disaster. So that's one sort of life position you can take toward the universe. Or number two, you can say the universe probably doesn't even know that I exist. It's benign. It isn't helping me. It's not hurting me. I'm just in it, and it doesn't even know that. Or thirdly, you can feel like the universe is out to reward you with whatever it is that you want from life on the planet, and so I just kind of like to know what your experience is, and I don't bring that up again ever, but it helps me to know, where are they relative to their whole attitude about life, and I know a little bit better maybe how to relate to them when I find that out. Um, I like to know where they think they live most of the time, their mental life. Do they live in the past? Do they live in the future? Do they live in the present? And we're going to talk about that in the hypnotic process a whole lot. Um, and I've done a number of presentations on this. I call it your wild bucking bronco time traveling conscious mind, and why you get into trouble with it. It'll go back into the past, and we need to be able to do that to learn from our experience, from our past behaviors. If we couldn't do that, we'd just keep making the same mistakes over and over and over again. And so we need to be able to have access to the past. We go to the future to plan, to have a vision of how we want things to be. And then we come back to the present and we start working on it. It's called planning or strategic planning from a business standpoint, is you got to be able to figure out what do I want that hadn't happened yet. And I love this saying by uh, Samuel Clemens, who said, in my lifetime, I've survived numerous disasters, and a couple of them actually happened. So we just terrorize ourselves all the time about stuff that hadn't even happened. So what I do is teach them about when you go to the past or to the future, the problem that you have if you're not prepared is that you'll gather the emotions that are attached to that event. And when you come back to the present, you're going to bring all that stuff with you. And I even show them a chart, but there are specific emotions, negative emotions that seem to live in the past that don't live in the present. They're regret and sadness and abandonment and guilt and grief and things like that are usually attached to some past event. And if you go up into the future, there's kind of anxiety and fear, and it's not going to happen, and disappointment, and all those things. And they're okay as long as they stay out there where they belong. And the problem occurs when we go out there and bring them back to the precious present moment and crap that all up, and mess that up, and stuff that doesn't belong there at all. So I teach them about wearing a Teflon suit when they time travel, and this is just going to be their conscious mind. Put on the Teflon suit, and let your conscious mind go wherever it wants to go. And then when you come back, take the suit off, shake it out, and hang it up on the line. Get it ready for your next time travel trip. And that's going to be your conscious mind doing that, because your unconscious is always right here in the precious present moment, because it has to be here, because it's beating your heart and breathing for you and blinking your eyes and doing all these things. So it can't afford to go off and, I think I'll take a little jaunt out, and meanwhile, who's going to take care of those duties? So then we talk a little bit sometimes about meditation. That meditation is the invitation from your unconscious to your conscious to come join me here in the present, and let's just sit here and meditate together. The conscious mind doesn't usually want to do that. It's like a bucking bronco. It's got business to do on both the past and the future. So we get into some of that. I want them to understand how it might be that they are terrorizing themselves unnecessarily. And so we talk about the meaning of meaning. I have a little, Patsy and Odette have seen this already. I have a slide and I say, what does this mean? And it's just got two tiny little fish that are swimming along, and the answer usually, well, it doesn't mean anything. And so I said, well, how about this? And then I put a second slide up, and here's these little fish swimming along, and behind them is this giant fish coming in with this huge mouth. And so what does that mean? Well, since we've introduced relationship, now it can have some meaning to it. Look like somebody's getting ready to be eaten for dinner, whatever. Okay, so now the third slide, what does this one mean? And now there's an even bigger fish with a bigger mouth up behind that one. What does that mean? And so the story gets more complex. And so then I introduce the idea, well, the only thing that means is what you say it means. There's no meaning in any event that's ever happened other than what we ascribe to it. So I want them to see that if you have a certain meaning, well, the reason I have to have this replacement done is because God's angry with me and is punishing me by making my joint fail or something like that, that I say, well, okay, well, that's fine. That's you have decided that's what it means, but there's no meaning in the event itself, because I want them to understand, as you can probably see, more and more of what we're building is I have choice. I get more influence over what's happening to me than I ever would have thought that I had. I've been acting like a victim, not on purpose, and not to maybe any more extent than anybody else does, but I don't have to do that unless I choose to do it. There are options that I can use about the way I think, and the meaning that I ascribe to certain things that are going on. We talk about the RAS, reticular activating system, which I say this is your friend, because once you decide that something it has an importance, your RAS will go to work and it will pop that out of the environment that you live in, the informational environment. And there's stuff that was there all along, but until it had a significant meaning to you, you didn't see it. And I remember the best example that I've decided way back when VW Beetles cost $1,995. I went out and bought an orange VW Beetle. And I came home, and on the way home from the dealership, I bet I saw 15 orange Beetles in that. They were there the whole time. I'd never seen them before. And all of a sudden, because I had ascribed some importance to it, oh, I got one of these things now. All of a sudden, boom, they're popping out all over the place. But until you ascribe value to something, the RAS is not going to lift it up out of the thousands of things that you see and as you go through life. We talk about affirmations. Noah St. John's idea about how to do a little bit step better than affirmations, where when you affirm something, you say that it's true, and it's usually not true yet. And that invites your critical function or your critical factor to attack it and say, that ain't going to happen. And what makes you think that's going to possible and all that. So we talk about, well, you don't have to trigger that critical factor. You can ask a question, like Noah St. John says, turn what you were going to say into, how is it that I'm more successful this month than I was last month? Or how is it that I'm going to be more successful next month than I am this month? And when you ask a question like that, your conscious mind says, I don't know. And so your unconscious says, I'll go find the answers. And it starts locating answers, and it starts feeding them to your conscious mind to choose the ones that are useful and reject the ones that aren't. So we talk about how to give them some choice about how they make their requests. Talk about the fact that all hypnosis is self-hypnosis, that I can be their guide. I can make it easier for them. I'll turn the lights down. I'll put on some nice dreamy music and I will speak in my deep hypnotic voice and, stuff like that. But I said, you're doing the work. I'm just your guide here. So I want you to understand that you're always in control. You can either follow or not follow any suggestion or request that I make. It's up to you. And you're not going to be uh, able to be forced or made to do something that you're not, that's against your morals or your ethics or your beliefs or anything. It's your choice the whole way through. And then we talk about the value of rehearsal, and that's when we're getting more into the medical side of it. Oh, by the way, what I've been telling you about takes about 3 hours with a client. So I guess I'm one of the few hypnotists I know of whose initial meeting with a client is 3.5 hours long. It's just, I want to load up their conscious mind with information that if I didn't do that would say, well, how about this? Well, how about that? And I don't think I agree with that. And what's this all about? So I want all of that to be loaded, preloaded into their system before we ever formally get started. And then at the end, I do a little 30-minute office hypnotic session just to give them a sample. Most of my clients have never been formally hypnotized before, so they don't really know what's going to happen. And if they're really fearful, I say, you want to know what this is like? And they, yeah, I do. But I'm scared. I said, okay, well, we'll make it real gentle. Okay, so I want you to close your eyes. And so they do that. I say, okay, now I want you to open your eyes. That's what it was like. I wish I could give you something a little bit more psychedelic, but I'm sorry, I ain't got any of that. It's a very natural feeling process, and I'm just going to be making some suggestions to you. And in order to keep the uh, conscious mind from getting in the way and interfering with what we're doing, I have 3 different things that I can do as um, processes that their unconscious mind can be freed up, and the conscious mind is going to have to focus on. So one of them is called creative animals, and I say I want you to pick an animal and let it puff up to 4 times its normal size, change the color scheme, put a new outer coating on this animal of fabric. It can be denim or corduroy or silk or whatever you want to put on it. And so this new color and this new fabric. And then I want you to just walk very slowly around the animal. I call it an appreciative walk around. Appreciate your creativity. And then when you get back to where you started, then let that animal just disappear. It can trot off down the road or float up in the air like a balloon or melt like an ice cube or whatever. Then pick another animal and do the same thing. And keep doing that until I ask you to stop. And meanwhile, what I need for you to know is I'm going to be talking the whole time you're doing that, and I don't want you to pay any attention to me at all. Well, that's pretty tough for people, that they get just, oh, what's going on over there? I think, and then they forget to work on the animal. So I keep reminding them all the way through the hypnotic process that how are you coming on the animals? Make sure you go back and keep working. We're not through yet. Also, I want to remove the critical factor from this whole process so that it's not attacking everything that we're doing with the hypnotic area. The next thing I do is have them plan an elaborate going away party for the part that's going to be replaced, for a shoulder and a knee or hip or whatever it might be. And I say, I want you to plan, but let's just use knee as an example so we can keep the the consistency with it. Say, I want you to tell this knee that you're giving it early retirement. You're not angry with it at all, that you're very appreciative, in fact, of all the work that it did for you all these years. And that it's not able to do what it needs to be able to do anymore without a lot of pain and swelling and loss of function. So I want you to make it feel as good as you possibly can. I want you to tell it that you're going to be removed from my body. You're going to be taken away in a surgical procedure. One of the things I found out, I've kind of coined a saying that nobody likes to be surprised. And this, if you slow it down, it's nobody likes to be surprised. If you don't say anything to your body about what's getting ready to happen, and you get in the operating room and they pull out this saw and and their body's saying, wait a minute, what the world's going on? It can get pretty angry with you and not respond very, very positively to what's going on. So I want them to do it. So the party is to honor the service that it has given you all these years, invite all the parts of your body that ever worked for or with that part, and pay their respects. And so I want you to make a speech, and I want you to write the speech out and then deliver it to me, because I want to know what you're going to say, because there may be some things I can help you upgrade or delete or whatever to, the work I've been doing is much more detailed than you might have been doing. And so I want you to take advantage of the best speeches that I know anything about. This really is a novel idea to most of them, and so I I wanted to tell you a story that was written up in the journal, the Ask a Professional. There's a woman who was gonna, she was about 70, she was gonna have a knee replaced, and so I'll just call her Judy. And she thought, well, rather than just have an imaginary party, I'm going to invite my family to participate and say, get ready to give an early retirement to my knee. And so I want you all to help me plan this party. Well, she had a grandson who was adopted. And he had two natural siblings, and then he was the third, he was adopted. And he always felt very bad about that. He was second class citizen. He wasn't real. He wasn't a real member of the family, all this, and he pouted and he was kind of belligerent. He was acting out about that. So he's over in the corner. He didn't want to play. So at the area where she realized that he was not going to be involved, she made this statement, and this is brilliant to me. I asked her if she wanted to be a hypnotherapist after it was over. She said, I'm really glad y'all are helping me, because my natural knee failed me, and it just wasn't able to last the amount of time that I last. But I'm going to adopt a new knee, and that's the one that's going to come and rescue me and allow me to walk around and enjoy being outside and with it, no pain, everything. Well, as soon as he heard adopted in that context, he sort of brightened up and everything, and he wanted to participate a little bit, and he was much different attitude. So then, when the party planning was over, he came up to her and he said, "Grandma, what are you going to call your knee?" And his name was Donnie, and she said, "Well, how about if I call him Donnie, this new knee? Because it's adopted and you're adopted, and so that seems like a good thing to do." Well, he thought that was just fabulous. She said, "But I had a problem. In about 3 months, I'm going to have the other knee replaced. And what am I going to call that one?" And he's, "Well, I don't know." And then he said, "I got it. Let's call this one Donnie number one." and that one will be Donnie number 2. And she said, that is a great idea. That's exactly what we're going to do. And so she was just kind of nodding her head, and she said, but now what am I going to call you? I can't call you, you were here before number 1. I can't call you Donnie 0. That doesn't sound very good. And he agreed that wasn't good. And she said, well, you let me know. And he said, I got it. I'm going to be Donnie the Great. So he became Donnie the Great in that family, and it totally reframed his meaning of what it was to be an adopted member of the family. And I said, that is one of the most brilliant things that I think I've ever heard. And it was just so insightful of her to do that. And that was really good. So this idea of these parties has got kind of associated with me, I guess, as one of my trademarks there with this thing. So I just got this note from a fellow hypnotherapist from Tampa. She said, hi, Art, hope all is well. I thought you'd enjoy my client's pre-surgery party story. She agreed that I could let you know. While working with her to prepare for a mastectomy, I shared with her your goodbye and welcome party ideas while we chatted and again during the trance. When she came out of the trance, she said she was going to have a real party, not just the one in her mind. When we spoke yesterday, she told me that a friend had stayed with her the first week after surgery, and now her boyfriend was staying with her. She said she walked into the kitchen on Sunday and found him eating something from the refrigerator. What is that? She asked him. This is the piece of boob cake that you saved for me. She and a friend had actually gone to the bakery and asked the baker to create a boob cake for her. And they worked on it, the first one the baker had ever made, and they worked on the design as the client wanted to be as perfect and realistic as possible. My client did really well during and after the surgery. I really love my job. So that was her application of this. I thought, what a fabulous thing, to actually go down to the baker, and he probably thought, boy, I'm never going to get another order like this one. But it was fun. So I use fractionation for the induction process because I found that that's a really quick way to go deeper and deeper and deeper and deeper faster than a long, elaborate hypnotherapy induction. I use something that I call the cloud. I have a cloud. I ask them their favorite color and their favorite number. And they tell me that, and I use that in this, and I say, okay, in a minute, there's going to be a cloud forming below your feet. And if their number was 13 and their color was purple, for example, I said, this cloud is 13 feet long and 13 feet wide, and it's purple. And it's filled with purple photons that are quantum energized particles of the way light goes through the universe. And it's going to come into your toes, and it's going to go all the way up to the tip of your head. And then it's going to do I'm going to tell you what it's going to be doing. And then at the end, it's going to come all the way from the tip of your head, all the way back down to your toes, and then out of your body. And what it's going to be doing is whirling and twirling and swirling around. And these little photons are going to be twinkling and blinking and flashing and everything. And you know how light attracts living creatures. The little insects will fly around the light at night, and we have campfires on the beach and lights on our dining room table or around the bathtub or whatever. We seem to enjoy watching flickering lights. They're kind of fascinating. They can even be hypnotic a little bit, I'm introduced to that. And so when this goes through your body, it is going to attract into this cloud anything and everything that doesn't belong there anymore. It's going to just pull that out of where it's hiding in the bones and the tissues and the muscles and tendons and ligaments and everything. And you've stored stuff. It's got muscle memory. There's a lot of stuff that's stored, and it doesn't belong there anymore. It may be a belief that you adopted from back when you were too young to know any better. That oh, blondes are dumb. Well, when you were little, you didn't know any better. You had no defense against that. So the interesting thing about children's brains don't have a reticular active. I mean, they don't have um, a critical function. And that's why kids are so fun to work with. I mean, because you hey, I tell you what, let's play a game. You be a superhero. Who are you going to be? Boom, they're right into it. An adult would take maybe 2 or 3 days to get into that level of ready to play an imaginary game. And so it's just fun to introduce people to the notion that they can have a way to get rid of that stuff. It's limiting beliefs, limiting decisions, um, identity terms that they may have. Oh, well, you're smart because your brother's smart, or whatever. They have these ways of making sense of the world. I have no idea if that's really true or not, but some well-meaning or maybe not so well-meaning adult told them, and so they believe it. Well, this really gives them a chance to get rid of all that stuff, to just shed it. So I say if there's anything and everything that no longer belongs in your system, may be a habit, it may be a belief, it may be a behavior that you don't want to engage anymore, allow it to go out into this cloud. And so then when it comes back down their body, it just brings all that stuff with it and poop out of their body, and they have had an internal cleansing just by using this cloud. And I also use it as an extended relaxation technique. We're relaxing all the muscles and the ligaments and tendons all the way from their toes to the top of their head, and then later from their head all the way back down, to their toes and out. So it's a wonderful way to actually part of the trance induction and gets them more and more relaxed, and they're able to just be in this place. The next thing we do is a lot of rehearsal for surgery. What I found is that one of the things that makes some of these activities that we are going to engage in that are a little bit scary, part of the scariness comes to the fact that I don't know what's going to happen to me. I've never been to the hospital before, or I've never had surgery before, or whatever. And so we start when they are packing their suitcase of stuff to take into to the hospital with them, and get them to think about what they might need. And then they get in. I said, you're going to walk in the hospital, and they're going to go through the admission process, which may be very involved. And you're going to wind up with a little plastic band around your wrist, and be prepared for a number of hospital staff people to come up and ask you, what's your date of birth? And you could say, yeah, it's right on here. Yeah, but I want to hear you say it. What's your name? Why are you here? What are you in here for? And I said, they're going to ask you, and you're going to think, doesn't anybody talk to anybody around here? I've told about 6 people the same thing. I said, it's just their way of checking to make sure that you're the person they think you are, and that you know why you're there, and that they know why you're there, because we've had tragic experiences where I think they said about 2,000 people a year go into the hospital for surgery and have the wrong thing surgically removed. And I thought, oh my gosh, how would it feel to be one of those people? So we got people that take magic markers and draw, not here, over here, not this leg over here, because they've heard about this, and they just want to make sure, that I don't want to come out with a knee on the side that was okay still. And so Anyway, we do a lot of rehearsing. I said, one of the things they're going to do is ask for your clothes, and it's already very cold, and you're going to really be cold, and they're going to give you this little pika butt gown, which is, just a little thin gauze thing. So ask them for a warm blanket. They're going to put you on a gurney, and you're going to be there. They're going to maybe put a little port in, and they're going to put some stuff in there to start calming you down before you go. And so then they'll come and say, okay, it's time to go to the OR. And you're going to roll down the hall, and you're going to be looking up at the ceiling, and you're going to be watching the light fixtures go by. And there's probably going to be one of the wheels on the gurney that flops, the blop, 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 blop thing that you get. And so I think of everything that I can so that they can say, oh, yeah, yeah, that's what we already practiced this. And it's kind of been there, done that feeling. And I said, this is like a play. And what do you think? How good a play would it be if none of the actors and actresses ever practiced? I mean, you can't just walk up there and do this, So let's rehearse. And they get this idea. Oh yeah, this is a natural thing that people do, and I don't have to be embarrassed about doing it or feel like I'm not as good as I need to be at this. And it's just this idea of the comfort that comes from recognizing what's going to happen. I said, eventually you're going to get to the operating room, and the doors are going to open, and it's going to be one of the brightest lit places you have ever seen in your life. And then pretty soon they're going to put something maybe over your eyes, and they'll start an IV and get you just really. And if they use propofol, they a lot of times will ask you a question. Oh, really? I understand that you're a hypnotherapist. What's that all about? I say, well, it's bloop, and the lights go out. And the next thing I know, I'm finishing that sentence in the recovery room because it just is wham, and it's over with. So I get them just used to it as much as I can. What's going to happen, and then you're going to be in the recovery room. I tell them that I will go to the hospital with you when you check in, if you want me to, and I'm not going to coach you or do it. I'm just going to be there. And the idea is my presence is a relaxing thing, that we've been through all this together, and I'm still on the team. And this is particularly good for people that don't have a family member who can join them for something like this, and they're would have been pretty scared by it. So they they have me there, and I say I'll also be with you in the recovery room if you want me to, but I'm not going to say anything there either, and you're going to be pretty goofy, and you're probably going to see 6 of me anyway. Your eyes are not going to focus very well enough, but I just want you to know I'm there. I'm with you. I'm your support team. I'll even be with you in the OR if it's okay with the surgeon and the anesthesiologist. And sometimes it is, and sometimes not. The the reason I would want to be there, I think, took shape one time when I was asking a surgeon if it was all right. And he said, yeah, I guess it'd be okay. But he said, I used to have an OR nurse, and she's retired now, but she used to put her hands on the person's arm, and she was talking to him the whole time that I was working. And I don't know why she was doing that, because they were out. I mean, they were gone. I said, yeah, they were out, but they weren't dead. I mean, their unconscious can hear you. Their conscious mind is what went out, not their unconscious. That's only going to go out one time when the big one happens, and we're probably not coming back when that one does. But meanwhile, they can hear stuff. And so I said, I will give you a handout if you're open to it, and it'll be some of the things this OR nurse was saying. And it is, okay, the team is getting everything ready now. They're well practiced. They've done hundreds of these surgeries. They all come out fine. Okay, now they're starting the surgery part of it. Now you're doing great. Your blood pressure is fine. I don't want you to bleed any more than you need to keep the tissue healthy, but you don't need excessive bleeding. And a lot of times the doctors will comment with, boy, that's the least amount of blood I ever saw in one of these surgeries, you know? And so I said, well, there's no need for them to be gushing blood out and losing it, because they can close off blood vessels. And so I have the anesthesiologist say, if you notice that their blood pressure is going too high or too low, ask them to put it where you want it. They please raise your blood pressure, or please lower your blood pressure, and give them a little bit of, just a few seconds to respond. If they don't, then you go do whatever you do to make it happen. But give them the opportunity to do it naturally first, because they have enormous influence over their body. They say, okay, we're about halfway through now. Everything's going right according to plan. You're doing great. You know, it's all working just the way we intended for it to. And now they're 3/4 of the way through, and your body's already starting to heal. They're closing this up now, and you're on your way. You're pretty soon you're going to be on your way back to the recovery room, and it's just a supportive, um, uh, success reinforcement, calming comments, keeping them advised on what's happening, so that they're not in the dark saying, "Oh, yeah, what's going on now." It's their unconscious that would wonder about this, but because their conscious is gone. So anyway, it's that kind of thing. And then afterwards, I say, when you get to your room, I want to come see you as soon as I can, because we want to start two processes. One is accelerated healing, and I use a process called upregulating the immune system for that. And the other thing is pain reduction. I teach them how to do physical or occupational therapy, because most people will stop the therapy if the pain gets bad. The least little bit of pain. Oh, stop! Oh, don't do that anymore. That hurts. And so um, they don't know about, I'm not supposed to cry. And I said, yeah, you cry all the time. That's your body's way of releasing the energy of pain. You can yell. That's the way. Have you ever stubbed your toe on the way at night, and you bang into some furniture? What do you do? That's your body's way of getting rid of the energy of pain. You ever curse? Oh yeah, boy, I didn't just yell, I cursed. I said, well, do that in therapy too. And they, oh, I couldn't do that. I said, well, then you're not going to get as much out of therapy. Tell the therapist that you understand some of the responses your body is going to naturally have about dealing with pain, and ask their permission for you to do those same things you would do if you were at home by yourself. And I said, even tell them, look, if I curse you, I don't mean it personally. It's just that you're hurting me, and I need to be able to get rid of that somehow. So they're looking for a knee replacement. They're looking for a full extension, and I think it's 135-degree flexion before they'll let you out of the therapy process. And they say, if you stop them before and you don't allow that to happen, what they're going to have to do is put you back to sleep again. And this could happen 2 or 3 weeks later. You've had adhesions that formed, and you've had scar tissue that formed, and it's blocking the joint from being able to bend. And so they're going to force it to bend. And if you think the therapy was painful, you wait till you wake up from that thing, because they're just going to take your leg and go, and break loose those adhesions and break through that scar tissue. So go ahead and deal with it by degrees, lessen that. And I said, because we are pre-programmed, when a muscle is stretched beyond what's comfortable for it, it locks up. And that's our body's way of producing a natural splint to immobilize that area so that it won't do further damage. And so what you're really recovering from is not the incision and the stitches. You're recovering from the shock of muscles that were stretched beyond their worst nightmare. And now they've got to get over that. And so they're they're uh, they're in spasm. And what they're doing in therapy is gradually working with that joint and releasing that spasm so that it'll do. And I said, the good news for you is you have one of the best coaches of how to do this built into your body. It's the knee on the other side, the one that didn't get operated on. Because they can have meetings and they have a language you and I will never understand. And this one that didn't get operated on say, hey, look like me, act like me. And look over here. I'm your role model here. I'm not having all this problem bending. So I want you to just relax and keep relaxing. And then, and the more you do, the more you copy what I do, the faster you're gonna recover and you're gonna be out and you won't have to do any more of the therapy. So it's um, it's just a matter of being with somebody and in a traumatic situation to the best of our ability, imagining what if you've been in surgery yourself recently, you know a lot of what this is all about. And so, you just jot it down and say, oh, I got to tell the person about this because I want them to say, oh yeah, that's right. Now I know what it's going to be like. And that's where you can really get the value to them of how to do this with a lot less pain and a lot less um, uh, a lot longer healing period. That you can shorten this down to where it's as good as their mind body system is capable of. That's what they'll experience, rather than anything other than that, or the worst that they can imagine. So I I had a fellow who had a knee replaced, and I was in his room. He had spent one night after the surgery, and he didn't sleep very much. And so I went to see him the next day, and he said, "Oh boy, I hope that's not going to be the way it is for a while because I didn't hardly sleep at all. This knee was just pounding and pounding, and I couldn't get to sleep." And I said, "Well, let me suggest a little something you can do here that might be helpful. You can try it and see." And so I used the NLP um, submodalities to change what he was experiencing. I said, "Where is the pain?" And he said, "Oh, it's underneath my knee. It's behind my knee, actually, in the back of the leg." I said, "Well, is it, what color is it?" And he said, "Oh, it's red. It's a fiery red and everything." I said, "Is it moving at all?" And, "Oh yeah, it's just boom, boom, boom. It's got all this movement to it." And I said, "Well, is it what is temperature?" "Oh yeah, it's hot. Really hot." And I said, "Well, if you could see it, what would it look like?" He said, "It looked like a big red ball, just this red ball that is just pulsating, with pain." And I said, "Okay, so here's what I'd like for you to do tonight. So I want you to say, okay, this red ball is going to be baby blue. And instead of being a ball, it's going to be in the shape of a tiny little blue box, top and bottom, four sides to it. And I want you to move it from underneath your knee. I want you to bring it up and put it right on top of your kneecap. And it's going to be very cool and not hot at all. It's not going to move at all. There's no pulsating to it. It's just going to sit there. And so we went through changing the submodalities in every way I could think of. He said it was heavy, and we made it light, you know, and so that it just barely touching his kneecap. So I said, all right, when you get ready to go to sleep tonight, I want you to just recite this thing. Okay, tiny little baby blue box, top of my knee, very cool, not moving. You know, he was going through all the submodality changes that we'd made. So I went to see him the next morning. I said, so how'd it work? He said, oh, it didn't work at all. He said, I did that thing you said. I said, okay, little blue box sitting on my knee and it's cool and it's not moving and you know and everything. And he said, I kept doing that over and over and over again. And he said, then I woke up this morning and I said, well, it sounds to me like it worked then, didn't it? He said, oh yeah, I guess it really did. Sometimes you have to almost not force, but you have to really get the client to acknowledge the change that they said they wanted, and they don't get it. They just don't. They're not even aware of the fact that they were successful until you know kind of make them acknowledge that it was. So I got some of the nicest letters from him and letters that he had sent to other people who were in pain. And he said, I got this trick that I learned from Art. Let's change the submodalities. And so he was so proud of what he'd been able to do, but he didn't even acknowledge that it had worked until I asked him. So sounds to me like it worked. You went right off to sleep and then you woke up this morning. Yeah, I guess I did. So let's see. What else do we got? This might be a good place to just kind of Q&A thing, you know, before we go any further. Are there any things that I've said that are not clear or that you want to know more about or whatever, anything that comes up?
You
Yes.
mentioned, Art, about post-surgery, the pain reduction, which we just talked about, and then you also said something about upregulating the immune system. Did I
Yeah.
miss something with that?
Sure. That's a term that I actually learned. I didn't make that up. I wish I had, but it's
It's a really cool one.
yeah, that's what it really sounds. So the idea is that we have an immune system that is monitoring all the time, and when it notices an attack of some kind, it revs up to a level to go do battle with that bacteria or whatever it might be, that's a germ. And then when it kills that off, then it'll pop back down to its normal monitoring level. So they said, well, the immune system is an open system because we know that it can be depressed with stress. And so I'm sitting here thinking, well, if you can depress it, then you ought to also be able to pump it up, you know? And that's when I started looking to somebody's probably already thought of this, I'm not be the first. So what you can do then is to say it's pumped up to deal with bacteria or germs, and you can actually pump it up to an even higher level than that temporarily. It takes a lot of energy, so it won't stay there very long. But if you've got an extraordinary large attack of some kind to your body, it'll go up and knock it out, and then it can come back to its high level function, and then it'll go back to its normal level function. So the way you can get it to do that is one to say, look, I know that you are the product of an evolutionary system, and you've had thousands, maybe millions of years to learn how to do what you do. And so think of what I'm going to say now as like a 2021 reboot, like turning the computer off and turning it back on again, or putting a brand new update of a software in there. And so what I want you to do is to um, you have a way of discovering where these invading organisms are. and I don't know how you do that, but I've only got five senses. So I'm going to say they look like something that doesn't belong there, and so you attack them, or they sound like something, or they feel like something, or they taste or they smell like something that that doesn't belong there, and so you attack them because they don't have this self marker that says I'm you, I belong here, and so you go after them, and you either surround them and starve them off, or you melt their cell walls, or you do whatever you do. And so, what I want you to do is to use a different identification uh, system from the one you've been using. So, as I understand it, I guess it was the First World War, they had a challenge response. You'd be in the foxhole at night, and there'd be some people saying, "Hey, Americans over here," and so there was a thing. They would say, "New York Yankees," and the response was apple pie or whatever, and if they didn't say the right thing, you knew that it was just somebody that spoke English, but it was the enemy, and so you didn't get fooled, and you attacked. So I said, I think maybe some of these things may be slipping past you, so I want you to use a different system from the one you've been using. If you've been using only one thing to identify them, and you haven't been using taste, for example, go up and lick them and see if they taste like they belong there. And if not, then they need to be eliminated, or they may smell different. That you don't pick them up. But it's obvious that whatever you're using, they've learned how to fool the system and get by and not be attacked. I guess cancer cells will grab little pieces of protein and
Right.
DNA and clamp it on the cells, and they get enough of it on there, and they look uh, to the
Yeah.
what is it, the T cells that go around and search for stuff. Looks like it's native, looks like it belongs there, and it really doesn't. So they're going to have to upgrade. And I said, look, I can't tell you how to do this because I have no idea how you do it or what you're even doing now, but and so just add on some new ways to challenge. Now, your evolutionary development may not ever tell you that that's necessary, but what I'm telling you is you got something bothering you now, like cancer, for example, is what I use it for a lot. And cancer's got all kind of tricks to fool our systems so that they're not recognized. And so um, you just upregulate by giving it new options of identifying things that don't belong there that it can use to be more effective at what it's doing just by using a different challenge system or identification. Now, one of the things I have to confess is that we're supposed to have about 70 trillion cells in our body. And in my mind, I'm treating each one of them like a sentient being.
Yes.
I do know that they eat, they make waste products that have to be carried away by the blood. They need nutrition, they need oxygen, they need hydration, they need um, uh, oxygen and stuff. So I just treat them like there's 70 trillion little creatures
I'm just
living in here. There's 70 little Art Juniors in here that are going, and that I can talk to them just the way I'm talking to you, and that they have a level or a way of understanding what I'm saying, and that they are responsive to that. And so I have a cancer treatment, for example, called Let's Make a Deal. If any of you remember that TV program, Let's Make a Deal. I say, look, with 70 trillion cells, we can tolerate a lot of um, noise level junk that's, not really helping, but we can't tolerate an infinite amount. And so supposedly we have cancer in our bodies the day we're born and the day we die. We've always got cancer, but it's our immune system's able to hold it down to a level where it doesn't cause problems. But every now and then it'll figure out a way to, to increase beyond that. And now we've got a malignant tumor and cause problems. So I say, okay, would you allow me to speak to your cancer cell community and negotiate with it? And clients always say, well, absolutely, go ahead and say whatever you want to. So I say, look, I want to have a meeting of the cancer community here, and I want to tell you something that you may not know. You may be ignorant of this. And it is that if you continue doing what you are doing, you're going to kill your host and you're both going to die an early death that's unnecessary. So if you want to live a longer life, you're going to have to make a couple of accommodations. And they're just two, really. You don't participate in a process called apoptosis, which is programmed cell death. You cancer cells don't ever die. And you multiply outrageously fast, and you don't contribute anything to the health and wellness of this host that you're inhabiting. So what I'm going to ask you to do is to restrict your multiplication and don't just keep multiplying until it overloads the system, because if you do that, you're all going to die. The other thing is, if you settle on a vital organ, you can interfere with its function so much that the person dies. So if you get into the stomach or the liver or the kidneys or the pancreas or whatever, you can mess it up to the point where it's not able to do what it's supposed to do. And then you're going to die. And so what I want you to do is to make an agreement of two things. Number one, restrict your multiplication to no more than half the amount that I just pick a number. It depends on what stage they're in, 1, 2, 3, or 4. And I say, half of the size of your community, you're going to have to get rid of 50% of it. And you've got to keep moving all the time. You can never settle on anywhere at all. You've got to constantly be circulating throughout the body. And if you don't ever stop moving, and you're only half of you that are here, then you'll be able to last a long time. And so out of enlightened self-interest, I hope you will act on this. And if you do, hooray for you and the host. And if you don't, been nice knowing you, but you just can't keep doing that. This system won't support it anymore. And I have a lot of people who are in remission now as a result of that. Now, what really happened, I have oncologists say, so what happened? And I said, I don't know. You're the doctor. You tell me what happened. All I know is that they're in remission. They said, well, I'm not believing it. A cancer cell understood what you said earlier. I said, you don't have to believe that. I do. I believe it, but you don't have to. So I have another one, for example, that of cancer, and I say, this is I seem to be patterning a lot of these off of the names of old TV programs. This one's I've Got a Secret. And I say, look, you've got cancer of the lungs right now. And there is a part of your body that has a secret about cancer. And it does not know that it's a secret. It thinks that all the rest of your body knows what it's doing, but it doesn't. And so I want you to call a meeting, have your lungs come to this meeting, and have this part that I'm getting ready to tell you about. And you introduce them to each other. They probably already know each other to some degree, but I want you to introduce them for the purpose of sharing this one piece of the secret, this piece of information. And then you leave because you're not going to be able, they don't speak English. So there's nothing you can do but just bring them together and say, yeah, you all participate in this process. So here's the secret. The organ that I want you to invite to attend this meeting is your heart. And the reason is that nobody has ever gotten cancer of the heart. And so it knows how to protect itself. Now, we don't know yet how it does it or what it is, what it's doing, but it knows and it never gets cancer. And we want to share that with your lungs so that they can start doing whatever this is and shed the cancer and get rid of it. And I have people that are also in remission from that intervention too. And again, I have no idea what happens. It just, it's a mystery to me, and I don't need to know. All I need to know is that I was the go-between that got them to meet and share some information, and that is all it took for them to turn this horrible process around. And so I like to pretend like I am whatever it is I'm dealing with. Say, it's no need to be angry with the cancer cells because they're just doing what they do, and any more than being angry with you for being human. I mean, so until you tell them something that they obviously don't know and give them an opportunity to do something about it, they're alive and they're eating and multiplying and this stuff we do, we eat and we multiply, so they're just doing it. And so you want them to do it differently, you're gonna have to tell them and give them a good reason for it. Dying, killing their host and then dying themselves probably is a pretty good reason for a living sentient entity to know, okay, I better do something about this, or I'm I'm committing suicide. I'm gonna contribute to my own death. So
All right, we
um,
have a question here, Kate, and I'll
yeah,
read it. She's asking you the question, do you treat cancer cells as is it a parasite or intruder instead of an attribute or facet of the host? Am I saying that
yeah,
correctly, Kate?
Yes. Oh, so now I'm lighting up. Okay, yeah, that I thought that was a very interesting. That it seems as though the cancer is an outside force or an intruder instead of an attribute or a facet or expression of the person. Instead, it's a host. So I thought that was intriguing.
Okay.
yeah. I could tell you my opinion, which is you know uh, about as close as I can get to the truth, I guess, about it. I think of them as cells that at one time may have been fine, and they got altered. Their uh, processes got changed in somehow. Their mutation, for example, of what had been maybe at one time a regular cell, and it mutated for a lot of different reasons. I'm beginning to think that stress is probably the most mutating factor that we live with, that it'll just do all kind of damage to living living material. Um, and so I just treat it as it once it mutates into a different kind of a cell altogether, then it loses its um, opportunity really to contribute anything, and then it goes off on this. Let's just multiply as fast as we can, and eat up. And actually, they secrete a chemical that causes rapid growth of capillaries
Right.
because they're growing so fast. They need somebody to bring the food and take the waste away, much faster than the body would do it. So they have to grow their own supply, to do that. So
Right.
they've accommodated to all kinds of ways that they have mutated away from normal or healthy. And I don't see them as an invading anything. I think they're already there, and they
You
just
were calling it a host, so that's why. So a host, so like a parasite would be an outside force or an invader, quote unquote. And when you had made it a host, but it's intriguing that different modalities. The one that you're talking about, uh, it's really the intention. So it is your intention in which you set to help your client,
Mhm.
uh, that it doesn't seem as if the therapist, which are, whatever our, belief system may be, as they say, the scientists' beliefs will affect the experiment of whether
Mhm.
it works or doesn't, or the
Mhm.
strength of it. And so it was, I guess, really my question was in a way a moot point as I think
Yeah.
about it. I just thought it was intriguing on how you had first said that we are born with all of these cancer cells, or these possibilities of, or probabilities of. And yes, indeed, it's pretty well studied that, well, in many facets, that stress is the kickoff, as it were, for these particular cells to then uh, work their magic, as it were.
I don't claim any medical accuracy with some of my thoughts, and sometimes they're inconsistent. Even the language might be inconsistent, but I just have an idea that if everybody had the best information, everybody meaning all of our 70 trillion cells. I had a problem. For example, Deepak Chopra says we are a persistent energy pattern. That's what we really are. This stuff here, this is not really me. This is just skin that got trapped into the energy pattern as matter, and there's cells, and there's not a cell in my body that was here 10 years ago, and there's not a cell now that'll be here 10 years from now. So my question immediately became, well, then how is it possible to have a disease that lasts more than 10 years?
Right.
Because all of them are gone. We ought to have a brand new everything, just, and so what I finally, came to understand is that a lot of disease must be a an information a glitch in the information system, that it's a data driven problem. And so I said, well, what I want you to do is every morning, I want you to, an imaginary meeting, all the new cells that have come in, say, look, I do not want you to take any instruction from the cells that were here that you're replacing. Deep in our unconscious is supposed to be a book of us in perfect health, mental, physical, emotional, spiritual, financial, social, whatever, and there's a picture of every single cell in the body. So there's 70 trillion pages in this book. And so I want you to go down and find the page that has a cell in it that's a problem. And once you understand how the book works, then tell all those incoming cells, go find your page in that book and do what it tells you. That's the clean original blueprint. And don't pay any attention, because I think what's happening is the information that these new cells get is flawed. And it's like if you ever seen this before, it used to be something we used to play with. Make a copy of a copy of a copy of a copy, and after a while it becomes totally unreadable. You can't even make out what it was, because it gets blurred, and it gets, little segments of it get left out. And so that's one of the metaphors in my own mind about, okay, well, maybe that's what's happening. Okay, well, then let's have therapies that deal with information. Let's talk that way to it and see if that will work. And a lot of times it seems to actually be what it took. You know, what started me on this, I get one is that I have a very active inner child that loves to play, you know, with ideas and things. So I had a woman come in, and she was a little blue-haired lady, and I have to acknowledge that I have learned a lot from little blue-haired lady clients that I've had. And so she said, I have cancer and I want to, I don't want to get radiation or therapy or chemotherapy or anything like that. You're going to be it. And I said, okay, I need your doctor to release you to me to do that because otherwise I get in a lot of trouble. And she said, the reason I want to do that is because the doctors all use a military metaphor. We're going to fight this cancer and we're going to kill these cells and we're going to do battle and, you know, it's a, you know, fight to the death and all that. And she said, I'm just a little lady. I don't want my body to be a battleground. Don't you have any other way to talk about cancer than that? And I sat there thinking about, oh man, she has nailed me. I don't. And I said, I do not. But if you will give me about a week, I want you to come back in. I'll make another appointment and I will have some other ways to talk about cancer. So when she came back in, I said, okay, so you're in your house and there's a knock at the door and you open the door and all of a sudden these people just push their way in, and they just come into your house and they just occupy your house. They eat up all your food. They sleep in all the beds are taken with them. There's no room for you anymore. Um, they have children and they raise these children there and everything. And pretty soon your house is absolutely overrun. What would you do? She said, well, I'm going to pick up a gun and shoot him. I said, no, you told me you, you didn't want that. So let's leave that. What else could you do? And she said, well, I guess I wouldn't buy any more food. I'd let the food run out. And I said, okay, good. Guess what cancer loves? And we talked about some of the foods that cancer loves. And, you know, we're gonna get your body very alkaline because cancer doesn't like alkaline. It likes acid, you know. We're not going to give it any milk. We're not going to give it all these different things, you know. So we're going to make it hungry. Okay, what else could you do? Well, I wouldn't pay the electricity bill and I'd let it get really cold in the house or really hot in the house and everything. And maybe they would be inclined to go move out, you know, go somewhere more comfortable. I said, okay, good. So we're going to make these cells uncomfortable. What else could you do? And so took her through a whole series of things where she could begin to appreciate, okay, so there is a new response that I can have to what's going on. I don't have to just be this dormant, receptive, cancer making machine here without doing anything about it. The fact that I didn't want radiation and chemo, that doesn't mean I can't do something. And so then we started working, you know, with the things. And I had another client that I worked with, and I make a CD for my clients about 30 minutes long, and on it I put what they told me they wanted me to say to them based on why they came in. And so I made this woman. She had, uh, I think she was in stage 3 or something, cancer. Um, she called me up about the 4th day, 3rd or 4th day, and she said, "I just wanted to ask you a question because I listened to this CD last night, and I woke up this morning and I didn't think anything happened at all. And then I listened to it again, and I didn't think anything happened. And again, but this morning when I woke up, it felt like all of these thumbtacks were just flying out of my body." She said, "Is that okay?" And I said, "Gosh, I don't know if it's okay or not." Nobody's ever asked me that. I said, I guess what I know about thumbtacks is that they're sharp and they hurt when you get stuck with them, you know, they're make ouch things, you know. And if my body was trying to tell me I got rid of a whole bunch of those things that were poking, you know, and making pain in your body, I would think that was a pretty good deal. And she said, well, that's kind of what I was thinking. I said, in fact, as I think about it, do you feel any better now? She had non-Hodgkin's lymphoma, and she said, yeah, I feel way different. And she was going into remission of that fast too. And so I said, well, I think your unconscious wanted to let you know that it heard you and understood what you wanted, and it was going to take action on it, but it didn't know how to communicate that to you. And so it it finally discovered, oh, you know about thumbtacks. Well, I'll just represent cancer cells as thumbtacks, and I'll say, yeah, we're getting rid of them. They're all flying out of your body. I would think that would be a pretty good thing. And she said, yeah, that's what I thought too. So sometimes I don't think we know how our body's response is going to be communicated to us. It's going to find some sort of symbolic way or something that, you know, I had a doctor hand me well, he didn't hand it, his nurse handed me a letter, and it was a referral to a kidney specialist, and he said, Art has kidney failure, please work with him. And so right away I'm thinking dialysis, and oh God, I'm dying, I don't know how much longer I'm going to do. And so I took it to a nephrologist, and he said, I wish these doctors would quit doing that. He said, everybody's got kidney failure. Your kidney started failing when you were 1 day old, and they've been failing ever since. But it's not enough to really create a problem, because we have these little nephrons that are little filter units in our kidneys, and we have high blood pressure. It just pounds these things and just blasts them, and you know, and damages them, and blasts them right out of the kidneys. And so that's a failure. And then there are other things that happen to the kidneys. And so I said, well, tell me how these things work. You know, so he's going into all this detail. He said, why do you want to know this? You're not going to be a kidney specialist. I said, yeah, but I got to make up a story to tell my kidneys, and they don't, you know, they'll recognize right away that I don't know very much, but I can tell them some things that might be useful. And he said, oh, that's the craziest thing I ever heard. I said, look, I'm a medical hypnotist, and medical means I deal with medical things. Even though I didn't go to medical school and all that, I can make up stories. Now that you've told me how these all work, and then and that's good. He said, well, one of the things you got to know is you were born with all of them you're ever going to have in your body, and all you can do is drink a lot of beer and alcohol and kill them off by the thousands, and you're not going to be able to replace them. You know, that's it. You got what I said. Okay, well, that's good to know. So I came home that night, and I said, I live pretty much in a state of hypnotic trance all the time anyway. So this morning I woke up and I said, kidneys, I need to have a little talk with you. That's all right. And I said, but before we get into that, is there anything you'd like to say to me? And they said, yeah. How come I worked 65 years with not a single comment from you, and I goof up one time, and now we got to have this little talk, you know? That I said, ooh, that sounds like I'm getting a performance review here. They said, yeah, what? So I said, okay, well, I will solve that problem. I will start appreciating you every day. I'm going to make a statement about how much I appreciate what you're doing for me. And I said, but in order to communicate with you, do I call you Art's kidneys? Or, and they said, no, well, you take us out of you and put us in somewhere else, and we'd be fine. We'd work there too. We'll transplant. I said, well, do I call you left kidney, right kidney? I said, no, you can take us out and swap us over and put us back in. We'd work just the same way. So, just call us the kidneys. And I said, okay. So I just came from my kidney doctor, and he told me what he knows about how you work, and the fact that that you that there aren't going to ever be any more. That's all there's it, and all I can do is just kill you off by treating you as gently as I can. I'm still gonna He said, who told you this again? I said, my kidney specialist. He said, that's not true. We make new nephrons all the time. And I said, well, okay, that doesn't square with what he's saying, but that's fine. What I need for you to do is make some more real quick, because apparently mine have damaged down to the level where it's showing up on lab tests. And so they said, so then I said, and there's a book about how you would operate in perfect health. It's stored in my unconscious, and you can find it. I'm sure you know where it is. And they said, no, we didn't know about that. So we'll go find it. I said, well, that's supposed to tell you how the perfect nephron is supposed to work. And so go find out what it's saying, everything. I said, and then tomorrow I'll check with you and find out if that was helpful. I said, oh no, we've already been there. We checked out. I really appreciate your letting us know. We didn't know about that. Good reference. We can use that. So I said, well, if you would start, making more nephrons, and there's something about creatinine was not the right level. It was way off the chart and everything. And so as soon as you can, just start doing that. And so I went back to see him, this doctor. It was about 3 weeks later. I had another exam, and then I said, I don't want to challenge your medical knowledge, but I was talking with my kidney cells the other day. He said, you were talking to your kidney cells? I said, yeah, but that anybody can do that. I said, here's the magic. My kidney cells talk back to me. That was the magic. And he said, okay, so you have this conversation again. So what did they say? And I said, they told me to tell you that they make new nephrons all the time. And he said, that's not true. And I said, well, they asked you to check it out. The next time I went to see him, he said, I owe you an apology. When I was in medical school, that's what they taught us. Just like when I was going to school, they taught us we didn't make any new brain cells. Well, we know now that we do. Well, we make new kidney cells too. Well, he was embarrassed, and he said, I went back and looked at some of the latest research, and we do. And he said, and your kidneys told you that? And I said, yeah, they did. And he said, and so you think your kidneys are talking to you? Is that right? And he's not sure he wants me as a patient anymore after that, I guess. I said, yeah, and they're talking to you too. And he said, your kidney cells are talking to me? I said, yeah, look at my lab report. And he looked at it and he said, holy mackerel, I have never seen anything like this before. Your kidneys are in better shape now than they were 3 weeks ago when you came to see me. Boy, and I said, yeah, I appreciate you're telling me what to say, because I didn't know, how to talk to him. And that's all I needed was a little information. And he said, you're the weirdest patient I ever had in my life. So it was just interesting how our interaction with medical trained people from us who work with the imagination. I mean, that's our organ of interest is the imagination, and our imagination, we can do anything. Well, as it turns out, the power of doing that can have a profound influence on our physical systems also, and beyond what the medical community wants to acknowledge that happens. So let's
We have
see.
so we've got, I see you, Patsy. We have about 15 minutes left. Oh, I could just listen for, like, this is all so interesting. So 15 minutes, let's take a question from Patsy.
Okay.
Go ahead, Patsy.
So Art, in listening to you, I'm struck by your ability to improvise and create a story that is in the interest of your client. And your stories are a little, well, they're definitely creative and maybe a little wacky. And they're very hypnotic. So as you're saying these things, it's so easy to just get sucked into the story.
Mm-hmm.
And I guess my question and comment is about perception, because you're fully immersed in your story as truth. And so I get into your story as truth. I'm thinking of myself on, on the other side of this as a client, how my perception changes, and your hypnotic storytelling
Hmm.
really enables me to uh, self-hypnotize, okay,
Mhm.
become engrossed in it. So that trust that I, as a client, would have in you allows that self-hypnosis. But the gift that you bring to it is your creativity in telling stories to the cells or to the kidneys or,
Mhm.
to the cancer, or to the immune, reactions, and your ability to do that so creatively and
Well,
intuitively.
thank you very much. And I think there's an element of that also, is that I very sincerely believe in my stories. If I was just creative and making up a story that would explain something, I don't think they'd buy it. If I don't buy it, I don't think they would either. So I really, I guess I have a quirky enough, loose grip on reality enough that I can accept it. Yeah, well, maybe that's true. I mean, who knows? So, but I bring, I think, a level of my own involvement in the story is as real as their involvement in the story, I guess. But thank you for the comment about creativity, because I just let my inner child go. But one of the things I do too, I'm sitting in the office getting ready for the client to come in, I just say, Lord, use me as an instrument of your healing power. I don't know what I'm going to say. I don't know what I'm supposed to say, but I'm sure you'll figure it out, and I just try to be a trance channeler, to the client and whatever that comes out. So a lot of this stuff I didn't know before they came in what I was going to come up with, and they sort of created the story on the spot. It just kind of grew out of that, and it's very exciting to me because I have a tendency to get bored doing something over and over and over again, and I never get bored with hypnosis because there's always an opportunity. Well, let's think about it this way, or let's think about it this other way, or whatever, and it's there, it's available to us. I mean, as hypnotists, what are we? We're storytellers, that's what we do. And to really get into that and enjoy it and appreciate it and everything, I think is the magic of hypnosis for the world, for our clients.
So when we, too bad we only have 2 hours. When we stop for a second for this interlude with questions and so forth, I have the impression that maybe there was another part to what you wanted to talk to us about. So I want to make sure that in the 10 minutes or so that we have, that if there is such, if we're missing something, that we can hear more about actually the topic that we talked about, that all of this is very interesting and also very relevant to it.
Well, I guess just one other thing that I happened on, by accident, I guess. I call it the king or the queen, depending on the gender of my client. Let's say they have. Let's keep it on the knee replacement thing. That'll keep it relevant to our topic. So they're in a position where they need to have a knee replaced, but they can't get it done right away for any number of reasons. And they've got an enormous amount of pain. So I somehow, and I don't know where these things come from, but I said, okay, what do you think would happen if the Queen of England were to contact her staff and say, I want you to pick out a town that I've never visited in person before in England, and make an appointment for me to go there, and I'm just going to be with them for a day, and I'm not going to make any official pronouncements. I'm not going to solve anything. I'm not going to, no treaties or anything like that. I just want to be there and spend time with my royal subjects. And then when the time comes that we've made, then I will actually go and be there. And so what do you think would happen in that little town before the Queen arrived? I say, oh man, I get they would probably be out painting the street, you know, and fixing up, clean up, shape up, you know, and they would have it as attractive and nice as they are capable of by the time she gets there. And I said, okay, so here's what I want you to do. You've got a problem going on in your knee. So I want you to announce to your knee that in a week, you're going to visit your knee, the area of your knee. You're just going to come down and you want them to show you around, you know, and just be there and look around and you don't have to fix anything or promise anything or whatever. You just be there. The present that you're giving them is your presence. That's all. You're just going to be there. And so they would do that, and they say, "Oh my gosh, you know, before I ever even got there, a lot of the pain was gone out of my knee. I didn't have the pain anymore. You know, I still needed the replacement, but it wasn't giving me near the problem it had been given before." I said, no, I think your system recognized, boy, you know, the Queen is coming. We got to fix this place up. It's pretty deteriorated, but you know, there are things we can do. We can make it better. And that's probably what happened. And a lot of the inflammation went down and a lot of the pain went away and everything, just because you promised to be. And I said, for God's sake, if you say you're coming, show up. don't stand them up, because it's liable to hurt worse than it did before. And so that's just something that I've coined, the emperor, the empress, or the queen, or the king. And so if you have a client that's got pain and they can't do much about it, just tell them this story and have, you know, just tell them to go be there. And just be in that area and look around. What does it look like inside of a knee? You know, I don't know what it looks like, but you can imagine. And just spend some time there, you know. Don't spend 2 minutes there, you know, stay for a while and let it know you're serious about it. No, and it's proven to be a very powerful intervention that you don't have to do anything. You don't even have to induce a trance, you know, you just tell them what to do and allow them to do it. So, and that's all, because I have to be asleep sometime between 2 and 3 in the morning, but other than that, I'm able to just keep talking. So you got to shut me up here.
And he's 3 hours ahead of us.
Okay.
So okay, so it's 7:54. Any last minute questions?
Yes.
For Art?
Yeah, Art.
Yeah.
Sir.
Have you heard of the book of John Howard? Are you familiar with John Howard? He was a British hypnotherapist. He wrote a book called The Simple Secrets of the Power to Heal. Back
No, that's a
probably I think he wrote that book maybe in the 80s.
mm-hmm.
When I was going through my basic hypnosis training under the tutelage of a guy named Jeffrey Knight at Knightsbridge Institute up in Portland, Oregon.
Mm-hmm.
He was from Great Britain. He went to Cambridge and practiced hypnotherapy in England. He used to work for Lloyd's of London as an investment banker and different things. He was a barrister for a while. But he met John Howard, and he got all the final copies of that book from John Howard. And I was pleased that Jeffrey gave me a copy of that book.
Wow.
And it's very much like this.
Mm-hmm.
You know, and I use it all the time, not only for physical pain healing,
Mm-hmm.
but also for trapped emotions. I have them visualize what's the color of it, what's the temperature of it, what's the shape.
Right.
Does
Yeah.
it go from one side of the chest to the other when you feel this pressure in your chest, this anxiety or whatever you're feeling? And I have pull out a jar of organic healing gel. I have a miniature version of them. I call their inspector up in that control room, and their mind looks like a nuclear power plant control room.
Right.
I have them travel to where the pain is the worst or the emotion is the strongest. And I open a jar of organic healing gel, and I have their inspector reach in, get 2 big handfuls, and slather it all over that
Great.
emotion, whatever they're doing.
Yeah.
And instantly, pain is gone, the emotion goes away, et cetera, et cetera. And I test it. I always test it. After we're done, I say, okay, so go back to the scene where your father was beating your butt in that garage that day where he created all that fear when you were 6 years old.
Mhm.
Go right back there again and see if you can find that feeling in your chest. And I give them a second and they're looking around. I say,
Can't do it.
not there, is it? It's gone. And it's not coming back. It'll never come back. But a testament to the power of the subconscious mind and the language of the
Yeah.
subconscious mind being imagery and metaphor, pictures and video, it's how it sees everything. As you illustrated brilliantly in your presentation, it's exactly what the subconscious mind listens to.
Yeah.
But I define hypnosis as visualizing with feeling. So forget this altered state of consciousness nonsense,
yeah.
because being drunk is an altered state of consciousness, but it's not hypnosis, or being
Not
high.
Yeah. Mhm.
I think hypnosis is visualizing with feeling or doing one thing and thinking about something else simultaneously. Those are my two definitions for hypnosis. And invariably, that always pans out. It always seems to work out. But I just love the verification that you provide with
Mhm.
your examples. And you're great at imagery and metaphor. Absolutely. And as you said, my inner child is just always so active.
Mhm.
That's hypnosis at its finest, providing them a visualization so they can see it, but not only see it, feel it. And that
Well,
feeling that you're providing them is really what launches the change, in my opinion. You're telling them how to do it. That's awesome.
It's another example, I think, of what we're supposed to do, and I'd never put it together before, is they say that you get yourself into hypnotic trance first and then invite them to come in. Well, I'm into my story. I'm already hypnotized before they ever even know, where we're going with it. And what was the name of the book again?
The Simple Secrets of the Power to Heal. So if you go online and try to find it, some places sell it for like $300-400. If you can ever find a copy of it, it's just incredible. And it's a thin book, very thin, but John Howard goes through different scenarios. If you have back pain, do this. If you have, a burn, if you broke a bone, how do you hyper accelerate the healing of it? And he goes through using organic healing gel, he said, but the patient will come up with their own method. How would you think that we're going to be able to heal that broken bone?
Yeah.
What would you do if you could do, you're invoking their inner child to participate. People support what they help to create.
Yeah.
One of the old paradigms in organizational development. And that's absolutely the truth. And people absolutely.
Yeah, one definition of hypnosis may be inviting our clients to play mental games with us, or just to have fun with it. But
absolutely,
I'm a bookie, so anytime somebody mentions a book, and I must have 500 or 600 volumes about NLP and hypnosis, so that's not one I've ever even heard of before. So thank you very much.
Very few people have, and it when I read that book, it changed everything. I mean, that blew my mind. And I apply it to everything because it's just visualization. I don't care if it's emotional. I don't care if it's physiological. It works.
Yeah.
It makes no difference.
Beautiful. Thank you so much.
Unfortunately, Art will have a bidding war as the prices are $70 to $79.
Good luck finding it.
Right.
Okay.
If it's in stock, if you can find it in stock somewhere.
Well, it's either in like France or Italy or Spain. It's not a common book at all.
Yeah.
If it's in the public domain, what we might do is pay you a whole bunch of money to make a copies of the book.
Well, I got a secret to tell you.
Okay.
I already have a digital version of it on my computer, and if I get your email, I will send it to you.
Oh, totally.
So anybody who wants it, you email me.
Oh.
hypnotherapy@gmail.com, and I will send you the digital copy for nothing. So you don't have to pay for it at all. There's my promise to you. But you have to want to care enough to send me the email to ask for it, or else I think you're just being gratuitous and I'm not going to send it to you. I want you to be serious.
I am being totally serious. I will certainly get on the
Good, it would be an honor.
it may be there before you get, are you home already?
Oh, yeah, I'm sitting
Yeah.
at home doing this in my home office.
Okay, you're at home. Well, I can't send it before you get home, but it'll be there pretty quick. Thank
And you'll
you.
have it by tomorrow. I have
Okay.
clients tomorrow, but when I'm not in my office working with clients, absolutely,
Good.
I'll send it.
Thank you so much. That
Yeah,
is
yeah,
that
yeah.
is a treasure there for
It's,
sure.
it's an
Yep.
unbelievable little book. I mean, it just, to me, I just thought,
Yeah.
but it's everything that we're talking about. And Lindsay would agree with this. Everything we're talking about here is just visualization. That's all it is. We're just providing a visualization. When you talked about the healing, and I like the woman, the old blue-haired woman that you talked about,
Yeah.
not wanting her body to be a battlefield.
Yeah.
But when I have something going on, if I sense I'm getting a cold or anything, I have this Roman legion of soldiers who has a commander, and the commander wears a little steel hat. He has a sword and a shield. And I ask him, I want you to send all your men to go find those cells in my body, and I want you to slay them. I want you to get rid of them. I don't want them to be alive anymore.
But, yeah. Mhm.
And invariably, I mean, it used to be I'd get colds many times a year. They'd last a long time.
Yeah.
I never do anymore.
That's
I
great.
just
Yeah.
send that out. I just believe it.
That's
I
great.
love that you talked about, who was it that you said you invoked, that you asked them for help? Oh, I think you do it yourself. My mother died in 2005 of metastatic cancer.
Mhm.
I was surprised to find out at the end of her life was reading the same things I was. Edgar Casey, Ruth Montgomery, Richard Bach. I mean, just tons of metaphysical things.
Right.
She's my conduit. Every morning, I put my hands on my desk and I ask my mom, I think she's my conduit to the superconscious,
Right.
help me find the words that'll help these clients who come here today make the changes that they're coming here to make. And I just trust it. I don't hear her talk. I don't see her. I get a feeling, but I just trust that the words that come out of my mouth are going to be just right for what the client. So like you, I'm not sitting here reading scripts. They just show up and I know I'm going to be there for them. I'm a conduit. I tell them, it isn't for me. I'm not doing this. It's you. You're attracting the energy to you and it's just coming through.
Yeah, that's it. It is.
Excellent.
This has been so fun being with you all. I love meeting a like-minded people that I can be part of a new tribe now. This is really fun.
Yes, absolutely.
Yeah.
Thank
Kate,
you.
you had something?
Do I have something? You know me, I always have something.
Yeah, no, I was reading your messages coming up on the chat.
No, again, I really appreciate, again, I'm very glad I was able to make this meeting, even though, again, I apologize for popping in and out, for taking care of some things I need to take care of here. But yeah, I definitely learned, which I like. You do a lot of things. I'm one of those weird people that actually, when I have an orientation, it is a 3-hour orientation at least. And so in terms of, really deeply interviewing a potential client and make sure that we're going to work together, because it's a collaborative effort. I tell them I don't have a magic wand. I can't bop you on the head and all of a sudden sparklies appear and I'm going to bippity boppy boop you and everything's going to be okay. It's a collaborative effort in terms of working together. But yeah, everything that you said is something that I think a lot of us here today engage in. So it's really a wonderful validation of our work as therapists. And I really appreciate the imaginativeness that you bring to this. So that's really sparked me. And I've not been sparked in a while, and so that's good. Thank you.
Hey, Mr. Brady.
Great. Please enjoy playing, as you work. I don't think I've ever worked a day in my life in hypnosis. It's all been just absolutely pure pleasure. I don't know what I would do. It's little things too. Sometimes I had a kid who came in and he was a real problem. He was very fearful, but he was a Harry Potter fan. And I've never read Harry Potter to any degree, but I had somebody tell, I said, is there anything in Harry Potter, somebody is very fearful, what could they do? And they said, well, Harry had this way of when some mega warthog or whatever comes in that was scaring him, and he could point at it and say ridiculous, and the thing would just poof and disappear or something. I don't know exactly what. So I found a little plastic collapsible wand, and it had a green uh, foam rubber finger on it, on a hand with a finger pointing like that. And so he came in, his mother brought him in, and I said, I got something to tell you about. And I said, when this thing happens and you're so afraid of it, here's what I want you to do. And I flipped this thing out and I pointed it at him and I said, that's ridiculous. That's all I ever said to him. And that was it. He was over it, you know, just that one simple little thing, but he believed in that, or he got pleasure out of it. I guess he thought it was hilarious, you know. And I just used it on him, and all of a sudden he was fine, you know, after that. Didn't take
That is Ericksonian hypnosis.
yeah. Right.
Right?
Utilization. Yeah.
Lindsay, did you have something to say? You've been awfully quiet. Can you hear me?
You're talking to me?
Yeah.
Yep.
Well, I'm just enjoying the whole scenario. It's the
Nice.
fastest 2 hours I can remember.
I know. It flew.
Isn't it great?
Absolutely flew. Love, as Art said, love like-minded people.
Well, I'm so glad that I'm getting this book free, Lindsay, because it's going to give me enough money to buy your books now, so I can.
Well, I will send you a free one of my As the Pendulum Swings book.
Oh, wonderful! That would be great. Yeah. And when this next one's out, I want to buy a copy of that too. I'd like to buy it from you so I could get an autograph on it. That would be even
Yeah.
better. So, yeah.
I'll make sure when that happens that it'll be available to everybody.
Okay, mighty good.
All right.
Okay.
If that
This is
is
great.
it.
Y'all are going to have a meeting now, is that right?
That's
just a
right.
couple minutes. Just a
Brief
couple minutes.
meeting.
Yeah, I don't want to scare the heck out of anybody, but yeah, just a couple minutes. We'll talk about some ASPH
Okay.
stuff. But Art, first of all, Odette, thank you so much for getting him lined up to have this.
Oh, I
Yeah.
was just thrilled.
Great job.
Yes.
Well, I was thrilled to be with you all too. That was just terrific. I love it. So,
Thank you so much, Art.
okay, thank
Fantastic.
you. Thanks, Pierre. All righty.
Have a
Thank
wonderful
you.
Okay.
Thank you
Bye
much.
now.
I'll be sending you that book as soon as I get to it.
Okay, mighty good. I'll send you an email. We'll do it.
Perfect.
Okay,
All
thanks
right,
again.
kids.
Appreciate it. We'll
You
see you
bet.
around the campus.
You got it.
All right.
All right, for the rest of you kids, let's talk about future sessions. Are we still interested in doing Zoom for our next session in the future, which I'm thinking of is about September-ish,
Yeah.
October-ish? I love doing this. We could
I
have
think
had a guy
Zoom is
like that.
great.
We could have a guy like that, the kind of speakers that we've been getting.
Anybody,
Larry Garrett.
has anybody sent a notice to our membership to see what, if they might want to meet in person? They might be itching to possibly meet in person and to see, just like when Lindsay had sent out his email, perhaps asking what the preference might be.
Yeah, we'll send out an email to the general membership, Debbie. Let's, you and I coordinate on that.
Okay.
Send an email out to the membership and see, do they want to do another Zoom meeting? Are they interested in having an in-person meeting? Would they show up if we had an in-person meeting? Because we're not going to do it if there's going to be 6 of us there.
Yeah, I'm surprised that we have as few on the Zoom meeting.
It blows my mind. So I'm
What did you
wondering,
say?
Okay, so I mean, not to be a snot or anything like that, but what does it matter whether it's 6 or it's 50?
Well, it matters to me. I mean, I think it's an embarrassment to the organization to have a handful of people show up when we have somebody that's so valuable imparting their knowledge.
Yeah, and this being such an easy way to join, you know, to
Absolutely.
participate, I'm really surprised.
Yes.
And
Believe that, I believe one of the problems tonight is the Suns game.
oh,
But
There are
Oh,
I thought about that.
people who,
I never even thought of it.
In 2 of the Western Conference finals.
right,
So, you know,
and I think that there were a few people who opted out of this to watch the Suns, and we'll have to find out when we're off to find out what happened.
sure.
So is that basketball or baseball? No, I'm just kidding.
No
basketball.
kidding, right?
I'm taking care of my mom and I'm watching the Suns game, so I'm doing all 3 things.
Couldn't hear you at
I
all.
would be in favor of in-person meetings, but Zoom is okay.
Yeah,
You're
I
in
think
favor of it in person?
in person, and I like in person.
Yeah.
You know, and for those especially who, you know, used to kind of complain about having to go, you know, a
Yes.
certain distance,
Yep.
and they're still not joining
That's
the Zoom
yeah.
meeting, so they might get back into doing it in person and enjoy that, so.
Well, those of us like me with low social needs, this is perfect, but I'm happy to do in-person
Yeah.
sessions as well.
Me
So-
too. Well, one aspect to consider is it's far easier to get amazing speakers from across the country doing Zoom.
You
Right.
could
Doing
not
a
have
live
a guy
meeting.
like Art do this if we had to do it in person. So we
Right.
would hash the same old topics with the same old cast of characters, and Larry Garrett same way in the last
Mhm.
meeting. Just amazing, world-class knowledge being imparted. It just blows my mind that we wouldn't want to do it by Zoom, but I get it. Some people have higher social needs than I do, and they like to be in the same room with other human beings.
Right.
There's nothing wrong with the hybrid. You know, offering the option of, you know, especially if say we have a speaker that is from, you know, whether another country, another state or something like that, to offer the hybrid port of doing a Zoom, as well as if we have somebody who's closer, who's willing to be in the area to do an in-person. I think that the mix may